Dr. Maitreyi, basically a very passionate Indian, but trained in the USA. So she's come here to make us understand what is movement disorder all about.
When you talk about movement disorders, it's in the name. So there is
Right.
a problem with bodily movements. These can broadly be divided into two kinds.
Patients coming and saying to you like, old age, so they become slow anyway, their mood goes off anyway, the cognitive function also can decline anyway.
Written by Adi Shankaracharya, a set of 12, verses. She said, please read this every day and seek your guru. So from that day, for 4 years, every single day, I read the Guru Stotra and said, God, find me my teacher.
I want to be more in the community rather than... And there's nothing, I'm not saying...
That's
of course,
true.
I really support research and all that. But it's just, I felt like my calling was more being in the community. So
I am not working for the pharmaceutical industry. I am not working for the device industry. I entered the OT alone and there's a big piano in the OT. So what's going on here? I just quietly came and sat in the, changing room waiting for the local fellow to come. Divorce rates among doctors. And number one was neurosurgeons.
it's a reality. Yeah.
Number one was neurosurgeons. I looked at it and said, I'm becoming a statistic.
No two patients are alike. I mean,
Absolutely.
Parkinson's
Exactly.
disease is, you have a set of symptoms, but I'm sure you can all agree that there are no two patients who are the same.
Absolutely.
Industry people are overplaying this technology. Surgeons are dropping their guard.
Terms we use this as on and off times. So the on times are when the medication is working, the patient feels great, they're able to move, they can talk, the voice is great, all these things.
And some of the patients are like this drug addicts. The moment they're going off, they swallow the medicine by themselves.
And then there's another condition called REM behavior disorder, RBD.
I'm hoping that between us, we will show you where medically, from diagnosis to optimal medical treatment is possible from the neurologist, and where we think it's medically refractory.
Okay, there's something wrong. I need to see a doctor. It's not just age-related things. I hope we can kind of deliver that message.
At least in resource-constrained countries like ours, where you can't say, if you don't have money for DBS, go and suffer. I can't say that.
Hard work is one thing, but to achieve what you want, I think is treat the patient, not the disease.